I'm a licensed and board certified family medicine doctor, Dr. Alpert. I'm talking with Dr. Zheng today.
So the topic today is about menopause, right?
Yep.
Yeah, menopause is such a hot topic because women play such an important role, and family we're not happy, then the family member will not be happy. So the main symptom, the hot flashes and night sweat, insomnia, mood swing. So uh, you think there's some simple method we can help?
Well, I think there are some natural compounds that can help, with a lot of the symptoms of menopause, especially the hot flashes. So there were some studies done in the early 2000s. So a study done in 2006 showed that Siberian rhubarb was significantly more effective than placebo over 3 months at decreasing menopausal symptoms and hot flashes. There was a follow-up observational study where they watched and monitored these women's symptoms over 2 years on the Siberian rhubarb, and they found that it was also significantly effective at reducing their symptoms and didn't have any significant adverse effects either.
Yeah, rhubarb. Spell that for us.
Rhubarb, but there are a lot of different species of rhubarb, and
Yes,
so the one
Siberian.
studied, yeah, was
Okay.
the Siberian.
Do you notice where you can find that?
So there's just different companies that make capsules of this
Okay.
extract
Okay.
as a supplement that people can take.
Yes, and there's rhubarb root, which is kind of food,
Right,
right?
right.
And I don't know if the Siberian rhubarb, do you think that's
It's probably similar,
similar?
I think.
Okay. Rhubarb in Chinese medicine, um, the raw one can uh, improve the bowel movement, so it cleanses the bowel. I know some practitioner they take that raw rhubarb periodically to cleanse them, and it's clearing the heat. And the cooked one, we can use that to improve the circulation. But the problem with the one herbs is sometimes the body just develop a what is that called? The
Like
adaptation
tolerance.
tolerance. So you have to go up with the dosage. I tried rhubarb to help improve the bowel movement. And yes, 1, 2, 3 days, you find the fourth day I have to increase the dosage. So um, if there's a capsule available, they can use that to help relieve all of the symptoms by clearing the heat, detoxifying the body, and what is the mechanism the study explained?
So I don't think they really know. Well, they think that it affects some of the estrogen receptors. So they think
Estrogen
it's like
receptor.
a
Yeah.
selective estrogen receptor modulator.
Okay. Okay. So I know the estrogen receptor can be occupied by phytoestrogen. For instance, tofu, sweet potatoes. I'm eating a lot of that because I don't want to use hormone replacement to to reduce the symptoms. It's a very hard, long process because your estrogen drop above 70%, progesterone even more. Progesterone is a relaxing hormone. So if we don't have that, and then we just hypersensitive to temperatures and to the stress, and so meditation is the way to train us calm down. And then your herbs, right?
Yeah, and soy isoflavones, like some soy
Mm,
components, can help too.
yes.
There's mixed evidence, but I think they can help. There's also a study in 2017 done on fenugreek seeds. 600 milligrams of fenugreek seeds was significantly more effective than placebo over 3 months. Again, I believe at reducing menopausal symptoms and hot flashes.
Yes, fenugreek. Is that the kind of a
It's a
the
seed.
the oh, okay. I think in the in Trader Joe's there is that's sell that as a spice or
I
cooking,
think they do. Yeah,
right?
there's a
Yeah.
fenugreek seed extract
Yes,
can
yes.
help.
Yeah.
It's we don't know that it's necessarily safe in pregnancy though, but for women, undergoing menopause, then it could
Yes.
potentially
Even
help.
rhubarb, even some kind of food, if you can cause the uterus contraction, then it's not safe,
Right,
right?
right,
Yeah.
exactly.
Castor oil is not safe for pregnant women. But I think I'm so scared of hormone replacement, and because my family member has a lot of different kind of cancer. It's not inherited, but estrogen is a stimulator. So I'm not afraid of tofu, but I'm afraid of estrogen.
Right.
Yeah.
Yeah, I think it does increase your risk of certain cancers like breast cancer.
Yes, yes. And so the breast cancer rate is increasing. And I read some report, 1 out of 5 women in United States,
Mm.
they develop a breast cancer. And the earlier you have breast cancer, the more dangerous it is because your hormone is not really low around menopause age. It's going up and down. But if you get breast cancer after 60, 70 years old, the 15-year surviving rate is much, much higher. And
Mm.
I observed a couple of cancer survivors, and one in Dana-Farber where I worked there for cancer patient. And this lady had a breast cancer when she was around 40 years old. And then she stopped drinking coffee. She only drink herbal tea. And then she was okay until she reached 70 years old. And then the cancer relapsed. But even in that kind of condition, the oncologist treated her. She responds very well.
Mm.
So the herbs really is a um, long-term treatment.
Mm.
So
Yeah, I think a lot of different herbs and natural substances can help with getting through menopause and all the symptoms. We
yes,
don't
yes,
fully understand everything because
yes,
some people hit menopause much earlier than others, and then we
yes.
have to be concerned about the bone loss and the bone density,
Yes,
right?
arthritis
So,
and yeah. So my experiences, um, if I stopped my period when I was 56 when my weight dropped, so I lost my weight dropped below 100. That's it. The estrogen is going downhill.
mm,
So that period stopped. So a little bit of overweight actually helps women went through the menopause because the fat stores the estrogen. Um, and if you're a happy person, you sleep well, then your adrenal gland also produce a little bit of estrogen progesterone. But if you don't sleep well, you're so skinny, then you have to use the herbs, right, to make your estrogen level at a certain level and not going too low.
mm. Yeah, and if your estrogen's too high, it can increase risk for cancer.
Yes,
You
so
know,
the
yeah,
balance is the key.
yeah,
So if you have any questions, you can email us. My email is lee.acumagic@gmail.com. If you go to YouTube, Li Zheng Acu, and just send us the questions, and Dr. Albert and me will help you to answer the question. Also, Dr. Albert has your own website, right?
yes, yep.
Is it called?
It's called bocadirectmd.com.
Yes,
So I post just on my blog every day for free about different natural remedies for a variety of medical conditions. And I put the
yes.
studies in there too. So,
Yes, and you also can prescribe some kind of a, like for instance, you can test the cortisol, estrogen, progesterone.
right,
Um, those are not covered by insurance, right?
right,
But if you really go through difficult time and you want to know what's the problem, then Dr. Albert can prescribe the test, right?
right,
Yeah,
right.
and you also can prescribe medication or
Yes. So
yeah.
in some cases, like I'll use topical only typically for like the hormone replacement therapy for women, especially women who are like very young when they first start menopause and we're really worried about osteoporosis or other issues. There's mixed evidence right now whether there's a cardiovascular benefit to hormone replacement therapy early on or not.
I think definitely there is because if those herbs help improve digestion, thyroid function, we know hypothyroid people have a lot of circulation problem and digestive issues. If the herbs improve digestion and improve circulation, the thyroid gland function better. So I think definitely there is benefits there. So if you are the person who really seek natural healing way, you can contact Dr. Albert and me. using herbs, acupuncture, or other supplements. I also remember you mentioned that you have a little ultrasound machine that you can detect. You did on me, right?
Yeah.
And for the blood vessel
For the
blockage,
carotid arteries is one of the main
carotid
scans that I'll
artery.
do. Yeah.
Yes, yes. Because I don't like a dye and those kind of a scan. And there's another question about uh, you know, if you do the whole body scan and then you find, the blood vessel blockage, I think it's too. I think this part is more specific, and if you find a blockage here, then you have to change. So, does your machine can also do the coronary artery scan?
Not yet.
Not
We
yet.
don't, yeah, we
Okay.
don't have the technology yet for ultrasound to get an
Okay.
accurate assessment, but we're getting there with MRI. So
Okay.
soon we'll be able to assess the soft and hard plaque in the coronary arteries with the magnets
So the
with MRI.
carotid artery scan, you can see what is the percentage of the blockage, right?
So you can get a rough estimate, right? So you can
Okay.
measure the blood flow, the
Uh-huh.
strength of the blood flow through the arteries, and you can see if there's any visible plaque.
Oh, that's wonderful.
So sometimes it's not perfect at, finding mild, or
Uh-huh.
maybe even moderate disease, but it's very good at ruling out severe disease or blockage in the
Yeah,
carotid
yeah.
arteries.
Do you think the calcium score or this ultrasound scan um, that combined can indicate what is the risk to develop coronary artery or heart attack?
I think so, stroke or heart attack.
Okay,
I use them quite a bit, quite frequently. I
okay.
use both those tests because I think, they're very informative. I have saved multiple lives just from doing the calcium scores, the coronary
Calcium
arteries.
score.
Yeah,
Okay.
or doing the carotid artery
What is the
scans.
optimized level of calcium score?
I mean, 0 is the best because
Zero is the best?
0 means you have 0
Huh.
hardened or calcified plaque visible in the coronary arteries.
But see, I have a friend, a Chinese friend, okay? She eat very little, everything very little. So she has calcium score 0, but she gained a lot of weight. And the other thing is her blood sugar. I tested them, my friend, and her blood sugar always below 100 because she eats very little. But I can clearly see she's gaining weight because she used to be very skinny. So I don't know if the calcium, she has a 0 and her husband has 1,900. Of course, the husband have diabetes and elevated A1C, but she does not eat very healthy. She eats a little cookie every every night. I mean, the worst time. So she gained weight. And so sometimes I was thinking the A1C and inflammation is correlated, but people who have normal blood sugar level does not mean they don't have inflammation. I have another friend
Right.
I tested periodically. I test 2 hours after dinner. So we have diabetic patients, and I have my blood sugar fluctuate. And this lady, she drink a little bit of wine, and she eats very little, a little bit salad, a little bit of carbs. And every time we tested her, she has blood sugar 2 hours after the meal below 100. And you would think that's very good, but she has different kind of inflammation.
Mm.
So I this make me think that your blood sugar could be in a normal range, but if you eat, like if you drink alcohol or you eat processed food, because the small amount, your blood sugar is still within normal range, but it does not mean you don't have inflammation. Is that correct?
Right, right. I think
Yes.
there's different types of inflammation. And interestingly, some people can have some plaque in arteries around the heart and 0 plaque in other arteries around the heart. So
Mm.
some people can have 0 plaque in 1 or 2 or 3 of the arteries, and then a lot of plaque in, just one of the arteries around the heart. And we don't fully understand why it's
A
only in
particular
one
area.
area
Yes.
versus another, but it probably is something inflammatory. Maybe there's a virus or something environmental or something else just affecting that one blood vessel.
Yes, that's so interesting because coronary artery, the main one is the left descending, right?
Right.
And my friend who has A1C above 7, sometimes 8, 9, he refused to take medication, and they find that that descending one is blocked a lot. And he's an engineer, so he analyzed that maybe that artery probably. What do you think? Because that artery has a different structure, it's easy to have blockage and.
Well, I'm not really sure, why one artery versus the other gets
Mm,
blocked, but I think with diabetes and other inflammatory, processes, it's interesting because there are certain probiotics that you can take that can lower your blood sugar, right, and lower your A1C.
mm,
So I think we talked about it a while ago that there's a probiotic that was
mm.
published in 2020 in the British Medical Journal that lowers A1C in type 2 diabetics by 0.6%.
Whoa.
And it's a newer type of probiotic, and it's just good bacteria for your gut that
Mm,
helps
mm,
lower the A1C. And I think
mm.
it helps regulate a lot of systems and helps with integrity of the gut lining. It has Akkermansia and different types of Clostridium and anaerobe butyricium in it.
So which brand is that? Because I never take probiotic. I take my own herbs. So which brand do you think?
It's called Pendulum.
Pendulum.
Pendulum is the company making
Mm.
this
Do they
probiotic.
have a store or online?
It's all online.
Oh,
Yeah, and so
online.
it's some
Okay.
lab it's a company out of California, and they use
Okay.
an anaerobic process to produce these bacteria. So I think they're using nitrogen gases to keep
Ah,
oxygen out of the lab environment to grow these
okay.
new types of bacteria.
Whoa, I'm gonna try
Yeah,
that.
I've been taking it
For how
for
many years?
years.
For years.
At least 2, maybe 3 years. I've been taking that
Okay.
for a while. Yeah.
Thank you for the information.
Yeah, you're welcome.